Joining me now, Dr. David Shulkin. He's the former Secretary of Veteran Affairs in the Trump administration. He's the author of a great book called It Shouldn't Be This Hard to Serve Your Country. And Dr. Shulkin, you are here for a number of reasons. You are a cabinet secretary, you are a doctor, you have run a medical system. So there are a lot of ways in which you've seen this. I want to start with what leadership should look like from the federal government in this instance, because we are stuck in a world where guys like me are on the internet, we're Googling endlessly about coronavirus. The good information is not nearly as salacious as the bad information, and panic sets in when we don't have real information.
Right. Ali, I tried to take my advice from healthcare professionals, not from politicians. So I think going to credible sources, listening to the people that really are professionals in public health is a good place to start. And, you know, my primary concern is for the safety of the public. So I don't think now's the time to do finger pointing. There's going to be plenty of time to do backseat driving. But I think we do have to stick to the facts, get the right information, and make sure that people are making good decisions based on facts and not on fear.
Okay, so the first piece of information that public health officials seem to need is good testing. We've had a delay in testing. Sounds like by the end of the weekend or by next week, we'll have 1 million test kits out there. How do public health officials think about testing? Because not everybody gets tested. That's not efficient in an outbreak. But we need good testing to figure out how many people actually are carrying coronavirus.
Yeah, I think the fact that we haven't had good access to testing to adequate numbers really has set us back, and it's created a void where people are making up information because we just don't have the figures ourselves. So getting access to those tests, I think, is going to be a game changer. But I think people aren't talking enough about screening. And I think that there can be adequate screening, and there should be good screening with asking people the proper questions, checking
screening
temperatures.
Is sort of a stage before an actual swab or something. It's
That's
a sense
right.
of, let me establish where you've been, what you're feeling, what your history of illness is, what your underlying conditions might be.
That's right. And some physical measures such as temperature and respiration. So I think with adequate screening, we can use testing in a sensible way and actually have data to be able to make fact-based decision making so that we're not having some of the overreactions that we're seeing out in the community.
Okay, you ran the VA. You've also run a private hospital group. Talk to me about preparation for if this gets more serious. On one hand, I think we need to remind people it's not existential. It's not going to eliminate the population. But we could be in a situation where lots of people get it and they go to seek treatment. Do we have the capacity in America for tens of thousands of people getting sick with coronavirus?
Once the testing is out there and we are testing more, there's no doubt we're going to see many more people with coronavirus. But we're going to find that most of these people have mild symptoms and aren't going to require severe medical attention. I do think with the advent of telehealth that we should be using our technology much more so people can remain in home and those that are mildly affected don't have to come into our hospitals and our doctors' offices and put other people at risk. But those that do require more intensive medical intervention tend to be those that are compromised medically or older. Maybe up to 10% of the people who are infected are going to require medical resources, and that will put a strain on our private hospitals. We've had a lot of capacity removed with hospital closures and bed downsizing, and we're not prepared for a massive pandemic that would require hospital resources. So that's where we do need to work in a public-private partnership. The Department of Veteran Affairs, for example, is the largest healthcare system in the United States. Our hospitals tend to have been built back in the 50s and 60s, much larger. So there is capacity. And one of the missions of the Department of Veteran Affairs is to train for emergency preparedness. And the professionals there do that extremely well. And there are authorities in public emergencies that the VA can help and step in. And so I think we're going to see a lot closer coordination between the public and the private sector in a response should we need the types of medical resources that many of us are anticipating.
And you were a cabinet secretary in the Trump administration, and we do have news overnight that the chief of staff, the latest chief of staff, number 3, has been removed, Mick Mulvaney, and Mark Meadows is moving in as the chief of staff. Tell me about this, because the president has sort of he's deteriorated the authority of that position over time. The chief of staff at one point in our lives has been the most important person in America, possibly second to the president. That's not really the case now. So what do you make of this change in the chief of staff?
Well, I, of course, worked with Reince Priebus, with John Kelly, with Mick Mulvaney during the time that I served in the administration. I think this might be the hardest job in government. It used to be that the job was to make sure that the president saw the right people, had the right information to be able to make the decisions that a president needs to make. And of course, we've seen that despite different styles, this is a tough job to do. And it's a job that, frankly, the president needs somebody that he's comfortable with, but I think most important, the chief of staff job, while they work and serve at the pleasure of the president, has to remember that they really work for the American people. And it's a very critical position to make sure.
It's a tricky thing in this administration.
It's a very tricky thing, but one has to retain a core principle of why they do public service. And I think that it's very important that the chief of staff have an important role in being able to make sure the president has the right information to make decisions.
David Shulkin, thank you for being with us today. David Shulkin is a former Secretary of Veteran Affairs, a medical doctor and an expert on public health. He is also the author of a great book called It Shouldn't Be This Hard to Serve Your Country. We'll be right back.